Okay, so, we always appreciate when you send in stuff that's caught your eye, and this week was no exception. Someone sent in this really in-depth document from the Pennsylvania Chiropractic Association.
The PCA.
Yeah, PCA, exactly. And it's got us thinking, about some of the challenges that chiropractors in Pennsylvania are facing, and it gets pretty specific about one particular issue and then a proposed solution. So we're going to kind of unpack that.
Yeah, let's dive in.
Exactly, a deep dive. All right, so, as we were going through this, the big thing that jumped out was this court decision, State Farm versus Robert Cavoto. And it seems like that's really kind of the crux of the issue here, right?
Right. It has really had a significant impact, essentially preventing chiropractors in Pennsylvania from delegating therapeutic exercises to their assistants.
To their CAs.
Yes, their CA.
And, going through the document, it seems like this ruling actually kind of contradicts the original intent of the state's, scope of practice law for chiropractors.
Yeah, it's really thrown a wrench into the works, and that's where House Bill 1106 comes in.
Right, the CCA bill.
Yeah, exactly. The Certified Chiropractic Assistant bill. So that's what we're going to try to understand today. Why is the PCA, pushing for this so strongly, and what exactly does it propose?
Yeah, and I think, the PCA document does a good job of laying out, why this is important. It's not just about streamlining workflows or anything like that. They really make several compelling arguments, talking about improving patient care, addressing workforce challenges, and of course, always a big one, maintaining those really important safety standards. So let's kind of start with the patient perspective. If you're going to a chiropractor in Pennsylvania right now, how are these current restrictions affecting you?
Well, the PCA makes a direct link between, this inability to delegate and the potential for delays in care for the patient. They're basically saying this is leading to longer wait times for people seeking chiropractic services.
Yeah, it makes sense, right? If the chiropractor has to be involved in literally every single aspect of the therapeutic exercise, that's going to limit, how many patients they can see, where they can focus their expertise. So how does this bill, the CCA bill, propose to kind of alleviate that and make it a better experience for the patient?
So the idea is that if you have trained certified assistants who can guide patients through those exercises, then the chiropractor is free to focus on, more direct. And the PCA uses the term advanced patient care. So think about it. A chiropractor's specialized knowledge is in diagnosis and those more complex treatments, right? So if they're freed up from having to do every single exercise with every patient, they can really focus on those areas where their specific expertise is most needed.
So the chiropractor can do their thing, the patient can get the therapeutic exercises that they need, and potentially it's a more efficient system all around. But I think a big question a lot of people might have is, well, okay, but what about the training?
Yeah.
What are we talking about here in terms of these assistants? The PCA is really emphasizing that these would be thoroughly trained and supervised CCAs. So can you talk a little bit more about that?
Yeah, absolutely. I mean, maintaining those high standards of care is a huge concern for the PCA. It's not like they're saying anybody can just come in and, oversee these exercises. The bill is proposing a very structured framework where these certified chiropractic assistants would have to go through specific training, and they would be operating under the direct supervision of a licensed chiropractor.
Yeah.
And that oversight is really key to making sure that patient safety is always the top priority.
And then shifting gears a little bit, the document also talks about some really interesting workforce challenges, and it even suggests that this bill could lead to more job opportunities within Pennsylvania's healthcare sector. So how would that work?
Well, if you think about it, creating this formal certification for chiropractic assistants, it's basically creating a career path for people who are interested in this area of healthcare. So instead of these roles being, less formalized, this professionalizes, it makes it a more appealing and potentially more stable long-term career option.
And it's not just about, creating new jobs. There's also the argument that allowing this kind of delegation could make the chiropractic practices themselves more sustainable businesses.
Absolutely, because if the chiropractor is freed up from some of those more routine tasks, then they can really concentrate on those high-level aspects of their practice and potentially see more patients who require their specific skills, and that increased efficiency can really contribute to the financial stability of these practices in the long run.
Yeah, and I thought it was interesting the PCA even says, Pennsylvania needs to modernize its approach to stay competitive. And I think they're referring to other states in the country.
Yeah, a lot of other states already have similar systems in place where they do allow trained assistants to perform these types of delegated tasks. So the argument is that by not doing this, Pennsylvania could actually fall behind and become less efficient, less attractive to both chiropractors and patients seeking care.
So let's dive a little deeper into that, maintaining those high standards, because the PCA really stresses that structured training and certification process. And they even go into detail about the key subject areas that this National Board of Chiropractic Examiners certification exam would cover. So it seems like a pretty rigorous process.
It is. There are 4 key domains that the PCA document outlines. So for the NBCE exam, 30% is foundational knowledge, and that covers, anatomy and physiology, clinical terminology, common chiropractic treatments. So making sure that these assistants have that basic understanding of the science involved.
Yeah, that's really laying the groundwork, isn't it? You need to understand that basic stuff to be able to operate safely and effectively.
Right. And then the next big chunk is patient safety and procedures. That's 40%. And this is really getting into, the practical aspects, how to use the therapy equipment safely, what to do in an emergency x-ray safety, and really importantly, being able to recognize when an exercise or treatment might not be appropriate for a patient, those contraindications.
It's good to know they're really focused on safety. That's reassuring. But then what about, the more administrative regulatory stuff?
Right. So 15% of the exam is documentation. And that includes things like compliance, making sure that patient privacy is protected, billing codes, fraud prevention, accurate record keeping, all of that really important stuff.
So it's not just about, the hands-on stuff. It's about the responsible practices across the board.
Exactly. And then finally, we have ethics and boundaries. That's another 15%. And this covers, professional conduct, confidentiality, harassment prevention, appropriate interactions between patients and staff. So really making sure that it's a professional and respectful environment for everyone.
So it's really clear this isn't just some, quick training program.
Yeah.
The PCA is really aiming for a well-educated, qualified group of CCAs. And they even reference the Federation of Chiropractic Licensing Boards, the FCLB, as providing the gold standard for CCA training.
Right. They want to make sure that Pennsylvania is aligning with those national best practices established by the FCLB so that CCAs in Pennsylvania are meeting, recognized and respected level of competence.
So we've talked about, better patient care, addressing workforce needs, maintaining those safety standards. But the PCA document also goes into CCA bill could lead to, greater efficiency in chiropractic offices and potentially even a reduced cost for the patient. So how would that work?
Well, the logic is that if you have trained CCAs who can handle these delegated tasks, then the overall efficiency of the practice is going to improve. They can potentially see more patients, the operations can be smoother, and that can actually lead to lower costs for patients.
So how does that translate to lower cost?
Well, if the practice is running more efficiently, their overhead is lower. Those savings could then be passed on to the patient in the form of lower costs for treatment. And then, of course, there are those shorter wait times that we talked about, which is also a benefit to the patient.
So it all kind of ties together, more efficient practices, potentially lower costs. And I think one thing that really stood out to me is this idea of reducing those administrative burdens on the chiropractors themselves.
Right. If they don't have to manage all of these, smaller tasks, they can really dedicate their time and energy to treating patients, managing complex cases, staying up to date with the latest advancements. And, the PCA even anticipates that this can lead to an overall increase in the number of patients that chiropractic offices can serve.
And then, another point they raise is strengthening regulation and oversight, which you might think at first, well, if you're allowing delegation, that means less control. But they actually argue the opposite.
Right. It's actually pretty interesting. They're saying that this CCA bill would create a more formal and robust regulatory framework because it would establish a certification process under the State Board of Chiropractic. So now you're bringing chiropractic assistants under the authority of the state's licensing body.
So instead of being less regulated, they're actually becoming more regulated.
Yeah, exactly. And there would be clear ethical guidelines specifically for CCAs and a disciplinary process if they don't meet those standards. So it's really about accountability and maintaining the integrity of the profession. The PCA views this as a way to modernize Pennsylvania's Chiropractic Practice Act.
And then the document also talks about, the bigger picture societal impacts, particularly when it comes to small businesses and, access to healthcare in those rural communities. So how does the CCA bill tie into all of that?
Well, a lot of chiropractic offices are small businesses, and they face challenges with staffing and finances. So by allowing this delegation, these smaller practices could potentially, operate more efficiently without needing to hire more doctors, which could really help their bottom line and ultimately help them stay in business.
And what about those rural areas where access to healthcare can be a real issue?
Well, the PCA argues that by making these practices more sustainable, the bill can actually help ensure that those services remain available in those communities. Because if practices are struggling due to staffing limitations, being able to use trained assistants could be crucial for maintaining that access to care. And they point out that chiropractic offices, serve a significant number of patients across Pennsylvania. So this could have a really widespread impact.
And finally, the PCA makes a really strong case for aligning with, what's already being done in other healthcare professions. They give a lot of examples of other areas where they use certified assistants very effectively. So can you walk us through a few of those?
Sure. So they talk about physical therapists and how they regularly delegate, rehabilitative exercises to PTAs. Physical therapist assistants, dentists commonly use CDAs, certified dental assistants, occupational therapists use OTAs, occupational therapy assistants. So this model is not unique to chiropractic care.
It's already happening in other parts of healthcare, so it's not like they're reinventing the wheel.
Right, and the PCA's position is basically that Pennsylvania needs to catch up and update its laws to reflect these practices that are already working well in other fields. They don't want chiropractic care to be the exception, and they believe that this will help ensure that chiropractic services in Pennsylvania remain competitive and efficient, and they're very clear that they see this bill not as an expansion of the chiropractor's scope of practice, but really as a restoration of the ability to delegate tasks within nationally established standards for these assistant roles.
Okay, so to kind of sum it all up, the Pennsylvania Chiropractic Association is making a lot of arguments in favor of this CCA bill. They think it's going to lead to, more efficient and timely care for patients. It's going to address those workforce challenges by creating this career path for chiropractic assistants. It's going to maintain high safety standards through that, rigorous training and certification process, potentially lower healthcare costs by making practices more efficient, strengthen that regulatory oversight of those assistant roles, provide support for small businesses, improve access to care in those rural areas, and really bring Pennsylvania in line with what other healthcare professions are already doing.
It's a pretty comprehensive argument. Yeah. They really seem to believe that this is vital for the future of chiropractic care in Pennsylvania.
So I think when you hear all of that, it really does make you think about this bigger question of delegation in healthcare as a whole, right? What kind of impact could this have on access to care, the cost of care, if more professions adopted similar models? It's that balance of efficiency, cost effectiveness, and maintaining, the appropriate scope of practice. It's really something to think about. So thanks for diving into this with me.
Of course, always happy to explore these topics.
And, keep sending in those interesting articles and documents, and we'll keep having these deep dives with you.
Absolutely.
All right, until next time.
See you then.
Bye.